Scott Anderson, head athletic trainer at the University of Oklahoma, and I've been here since 1996.
And you have a rich background in athletic training and just the medicine field in general. Can you just take me through that and kind of how you've worked your way to the University of Oklahoma?
I did my undergraduate at the University of Oklahoma, and then upon graduation had an opportunity to be an assistant athletic trainer here in 1987. I went to Tulane University as the head athletic trainer, and then again an opportunity to come back here in 1996 in this current position.
One of the things I talked to Pete about, just about you in general before setting up the interview, was he told me you have a unique knowledge about concussions and just a thorough background with it. Can you just take me through kind of your general knowledge of concussions and kind of where that stems from?
A large part of it stems from the fact that we participated in NCAA sponsored research through Kevin Guskowitz and Michael McRae back in the late 90s, 2000. That data set produced two articles that were published in the Journal of American Medical Association in 2003, and those were seminal studies. They have prompted some of the standards of how we manage concussion today, not just at the University of Oklahoma or collegiately, but how concussion is managed through the industry of sport. And so certainly that experience and exposure was a factor. We had opportunity institutionally to gain some helmet instrumentation that measured impacts, and via that we did some independent research, and we've also contributed that data to a consortium and continue to do that. And so it was really a confluence of events that have given us research opportunities, either independently or with a group, and so we've just developed that and tracked the industry as a whole.
Now, Pete also talked to me about how you were kind of the leading voice to bring some of that equipment to test concussions to the University of Oklahoma. Is it kind of close to you, a little personally, just to research concussions, or?
Well, we have an interest and a passion within our staff for making sports safer for our athletes, and with our entire sports medicine staff as a whole. Dr. Schnabel, our head team physician, he was a key factor in being able to bring that helmet instrumentation onto campus. He also gained a similar set of that product for a high school, and so we had the first research that compared impacts in high school versus impacts in the collegiate football. Dr. Randy Eichner was our team internist for a long time, and in terms of some of the general medical issues, he helped us be a leader in some expansion and margin of safety for our athletes, especially those with sickle cell trait, exertional heat illness, some of those factors as well. And then Dr. Phil Adams is a cardiologist, and so working with him on some cardiac specific issues, but general wellness. So the concussion component is a key part of what we do, but it's not the only factor that we've been involved in.
Obviously player safety is just playing a huge role in the sport of football and really across all sports. Can you just take me through, when an athlete gets a concussion, what exactly is a concussion that what are they going through in their body?
Yeah, there are a multitude of definitions. That's part of it. I think what we don't know is greater than what we know, and so even something as simple as coming up with a definition Again, there's over 40 out there. The one that we've used lately is it's an alteration of brain function from a force with cognitive and neurologic dysfunction in simple terms. But then, as an athlete has a concussion, identifying that that becomes the tricky part, because we really don't have subjective or objective measurements that are really sensitive and specific to concussion, and so that still becomes the trick, is identifying the concussion as it occurs. We relied a great deal still on self-report, and those become the challenges on the return to play progressions as well.
So, you said there's so many just definitions of concussions. Are you continually learning about just the injury itself, and are you continually seeing new cases of the injury, maybe perhaps?
Oh, sure. Certainly we're seeing new cases of it. The concussions continue to happen, and they will continue to happen with the forces of sport, and not just football. It's not a football issue alone. That certainly gets the focus and the attention, absolutely. But it's critical that we address it in other sports as well, and we do continue to learn. The amount of research since 2000 swamps any amount of research that was done prior to that. So we're in an era where we're learning.
The University of Michigan is leading an extensive NCAA research project on concussions. I think that started earlier last year. And OU is one of the schools involved with that. Can you talk about maybe your knowledge of some of the project, what they're looking to do? Obviously, they're looking for a concussion protocol and whatnot, but can you just kind of talk about your knowledge of that project and how OU's maybe played a role with that?
Yeah, we're one of a handful of institutions that are participating in that, and it's designed to look at the natural history of concussion, and it is looking at every athlete in every sport, whereas again, it's been a predominant football-focused research, and that's really been the extent of our research in the past, whether NCAA or institution-generated research. But this is again looking at every athlete in every sport, it's an initial 3-year study, but it's looking at all the factors in terms of baseline testing and demographics and then a progression of the study of those things as concussion occurs, looking at computerized neuropsych testing and balance testing and some of the things that we have that have become a standard of concussion management, trying to take a look at those things and maybe gain a greater appreciation of the validity or lack of validity that some of those tools have. The Michigan study is really one study in a pair of studies that's ongoing. The Medical College of Wisconsin is doing a study looking more at some imaging, genetics, some other markers as well, and so those two studies are really tandem studies under the NCAA Department of Defense and through the University of Indiana. Certainly, one of the challenging things is they tend to present very in an individual fashion. Different individuals will have a different set and presentation of symptoms, and even the same individual with recurrent concussion can present in a different fashion, and so it becomes again, identifying that somebody has an issue and then a differential diagnosis and understanding those neurologic and cognitive deficits that can occur. And so we're certainly looking at some short-term recall and some long-term recall, balance issues, and just some general factors of cognition. and then it becomes some serial assessments with that as well. NCAA rules dictate that as concussion is identified, the athlete is removed from participation that day, be it practice or game, and so that factor is dictated to us, and that's a good rule. That's expanded the margin of safety for the athlete. So it's an identification, it's a removal, and then it becomes a serial repetition of those assessment processes, involvement of the physician in the care, an awareness in our population that it's not just athletics that they have to participate in, but they have to be competitive in the classroom as well. There's growing awareness of the impact of learning, and not just a return to play process, but what's called a return to learn process, is that we understand that not only are the physical aspects affecting that brain function in concussion, but the classroom academic cognitive issues that go along with that as well. And so we have baseline testing that we do pre-participation with our athletes that gives some subjective information. We repeat those baseline tests. We do comparison with that. We seek an asymptomatic state for return to play and return to learn, and then with stepwise progressions from there. We have gained an appreciation for the short-term consequences of concussion. We're gaining a greater appreciation for the more long-term effects of concussion.
Yeah, and just how important is it to go through the entire process to meet, like you said, the return to play or the return, just return to the field, whichever it may be. Obviously, they're both important, but how important is it for you guys to go through the steps in their entirety, and just the important measures you take to ensure that athlete is completely safe before they get involved with anything again? The steps, while specific to concussion, aren't necessarily unique to concussion in that with any injury, we're seeking an athlete for a safe return to play, that injury has healed, such that they're not at risk because they're impaired because of that injury, and so that they're a diminished risk of recurrent injury as well, and so we've certainly over the last few years built more time into a return to play for concussion than probably what we did previously, because we have a greater appreciation for concussion, and again, the short term and the long term of it. Like a torn ACL, athlete goes through a long recovery process to get back from it. What's a recovery process look like for an athlete in terms of just ensuring that they're doing the right things, maybe outside of your care, to ensure that they're doing all right?
Yeah, with anterior cruciate, for instance, it becomes fairly easy to make a diagnosis of anterior cruciate injury. There are some physical exam tests that we can do, and we can tell on the field, on the sideline, almost immediately that they have a torn anterior cruciate ligament. We can't do that with concussion. We can send them for imaging, and that can further define the extent of the injury. We can send a concussion for imaging, and it doesn't. And the imaging, they can be densely concussed, and the imaging can be read as completely normal. So imaging doesn't give us that. We have an understanding of a post-surgical reconstruction of the physiology of healing that's going to occur there, and we know and understand that process and how it's going to occur, and over time when it's going to occur, and so we can tailor their return to play with that, their progressions of activities. We don't have that breadth and depth of knowledge with concussion, and going back to the NCAA Department of Advanced Studies that are occurring through Michigan and through the Medical College of Wisconsin, we're hoping to be able to gain some of those biological markers and imaging and progression of concussion and those types of things, and have a greater appreciation for concussion similar to what we might have for anterior cruciate ligament injury.
Obviously you've been around a lot of injuries. What's one that maybe stands out to you most that maybe you took a great pride in really working it back? Obviously all injuries are important to heal, but maybe one that really kind of stands out in your mind as one that really just kind of stands out to the forefront.
Yeah, I don't know that there's really one. It all becomes pretty relative in that we really focus on the individual, and so what might be a minor injury in my eyes is pretty substantial to the individual as they've suffered it and they're going through it, and the opportunity to return to play. And so again, it becomes relative, it becomes individual. We focus on that athlete at that point in time, and a progression of what's going to be in their best interest. Sometimes it's in their best interest not to return to play. It could be a career-ending type of injury. It could be an injury that does gain a return to play. But so, I don't have one that stands out. We take a lot of satisfaction in all of those that are injured and do return to play, because that's their passion. That's what they want to do. We don't necessarily consider it a loss wholly fully if somebody doesn't return to play. Again, that ultimately is in their best interests. But again, it's just managing per athlete, and we kind of grieve when they grieve, and we celebrate when they celebrate.
So, per injury, just really any injury, obviously you said even the minor ones that you consider could be a major one for an athlete. Do you guys do a lot of, do you reach out to other doctors, maybe specialists in a specific area to gain second opinions on specific athletes that go through injuries, or do you guys mainly just kind of go through in-house kind of stuff?
Some of both. We have a core of athletic trainers and therapists and physicians that we work with on a daily basis, and we manage the great majority of the medical issues that we have here with our athletes. But being at the University of Oklahoma, an affiliation with Oklahoma Health Sciences Center, the medical school, and the professionals there, being in a major metroplex like Oklahoma City is, and there's a great rich history and tradition of medical care, and so we're blessed in this geographical area and in this university that we've got some exceptional medical providers, and so we have a very low threshold for reaching out and getting our athletes the best care that they have, whether it's an individual provider or a facility or whatever it might be.
Can you take me through just the impact of a concussion injury, maybe the long-term effects and the short-term effects that they have? What is it overall? What does it do to the brain that might affect it down the line that maybe you don't necessarily know about at the current time that an individual is going through a concussion?
Well, I think you said it. We really don't know at this point in time. What we have gained an appreciation for recently is that there is obviously some short-term impact and effect to the brain, and we have to assume that there is some long-term to that as well. We have to assume that those things become cumulative as well. That as an individual has recurrent concussion, that those aren't just isolated, unrelated events, but again, there's something cumulative going on there that we have to pay attention to as well, and that whether one or multiple, that there can and may be long-term consequences to that. We certainly understand that with some of the musculoskeletal injury that we see, again, as an individual tears an ACL, there's a change to the joint there, and that change is lifelong. It doesn't go back to the joint that God created and gave him at birth. And we have to assume something similar is happening to the brain as well, and factor that into our management.
Do you believe, in your eyes, that enough education exists right now as far as is helping student athletes go through a concussion injury? I mean, obviously we've talked about the numerous studies, so there's continual research, but at this moment in time, do you think there's enough to properly assess and handle concussion injuries?
That's another project that the NCAA is taking on, is education and having some effective education. I think there has been some benefit from that. There is an increased, if we look at concussion incidents, there seems to be an increase in concussion incidents. Is that because concussions are happening more, or maybe because with the education, concussions are being reported, whereas they wouldn't have been reported in the past? And so I think education is a key tool, and is going to be a strong factor in expanding the margin of safety with sport, and so that's something we focus on, and we continually to strive to improve, is our education of our athletes and of our coaches of the signs and symptoms of a concussion, so that they can be reported when and as they occur, and an understanding that it may not be the individual with the concussion, but it may be a teammate or a coach that sees the signs and the symptoms and reports the athlete to us. An understanding of behavioral factors that for the athlete and for the coaches that are going to create risk and limit some of those situations and circumstances that would elevate and increase the risk of concussion for our athletes. And so absolutely positively, education is a significant part of the steps to continue to expand and make sports safer.
And then with just your background in medicine and your work that you've done with football, have you noticed maybe the learning curve for athletes and the way that they go about, learning how to tackle, that kind of stuff? Does that play a big role in maybe how concussions can come about in terms of ensuring that they're being safe in how they play the game?
Absolutely. As we look back over the history of the sport, rules changes that focus on better technique, and then enforcement of those rules and that result in behavioral changes. Those are difference makers, and so as we've taken the head out, for instance, in 1976, spearing was outlawed, and there was a significant drop in catastrophic injury and death. That 10-year period before 1976 was actually the most deadly period that we've had in the sport, even worse than the early 1900s when Teddy Roosevelt threatened to ban the sport. The mid-60s into the 70s were much worse, and so that rule change, that behavioral change, absolutely expanded the margin of safety for football players in sport. Again, particularly focusing on tackling technique. In 2005, there was an amendment to that rule where they eliminated intentional from the spearing rule. It really wasn't until 2013 that was enforced with the targeting rule and expulsion of the player and marking off the yardage and those types of things. So that emphasis in 2013. It's still early, but there is some preliminary indication that emphasis on that rule and technique and behavioral change may have another effect of an expanded margin of safety. We haven't had a catastrophic cervical spine injury in a game in those 2 years period of time. So Absolutely. Again, there's nothing that beats sound technique for an expanded margin of safety, and so that's part of education of athletes, education of coaches, education of game officials. It takes everybody involved and everybody on the same page to make that happen.
Put yourself in a lead role, if you will, and if you were in charge of player safety just at a football level and knowing what you know, what's maybe one thing that you would like to see implemented that would help the injuries situation with the game and hopefully make it even better?
I'm not one of those people that really thinks we need to change the rules of the game. My philosophy is we have good rules on the books. Are we properly enforcing those rules? And not just in games, but are we focused on good technique in practices as well? And so again, it sounds a little bit trite and oversimplified, but again, it's emphasizing the rules in practice, in games, an emphasis on technique, an emphasis on behavioral actions, taking the head out of the game, and reducing contacts and impacts, and that, in my humble estimation, is a doable deal, and still results in a very competitive, well played a game of football as well, but with an expanded margin of safety versus what we have. And I think we're inching there, but I think we could have greater movement than just in inches.
Probably the biggest piece of my project is just looking at the education aspect of concussions, and to get people to kind of just understand what they are, and that football players, they have a job, technically you could call it, to play the game that they enjoy. How much of it is just kind of a risk-reward outlook maybe for them, and that they're doing what they love to do, what they want to do, just like what you love to do, treating athletes and making sure medicine is up to date.
Well, it does become, I suppose, a risk and reward type of thing, but virtually everything does. We can look at catastrophic cervical spine injuries, and the state of Oklahoma has some data on how and where those occur, and really in sport, that's one of the safer realms that it can happen. If we look at catastrophic cervical spine injury in wrestling and football in the state of Oklahoma, it's a very small percentage of the catastrophic cervical spine injuries that occur, as opposed to diving, hunting, riding horseback, trampoline, various other activities that individuals engage in that carry more risk than does sport. And so, from my standpoint, I try to maintain a relative aspect and look at it as well, that there is a relative safety in sport, but I'm not going to be fooled into thinking that we can't make it better and that we can't make it safer, and there aren't some problems that we need to fix. And so that's what we continually try to do. Again, as you note, education becomes a key part of it, is having our athletes and having our coaches understand those situations and circumstances that present risk for them, and gaining their knowledge and understanding and a cooperative action and work towards altering some of those setting and circumstances, and changing the behavioral outlook, and with that a safer and even better level of play.
Perhaps one of the biggest aspects that's come out in the past couple of years is just the relationship between concussions and CTE. Can you talk just about that growing kind of concern and the growing field of that topic in relation to concussions and kind of how that's just playing out? Is that something that perhaps is related more to more violent concussions, or still growing in the knowledge there?
It's growing knowledge. Again, it's something that can't be dismissed. There's no firm, definite scientific tie, so you can't dismiss it certainly. And so, again, it's whether CTE or whatever it might be. Again, we're focused on the short term and the long term as we manage and work with an athlete to make decisions, as we educate them when they have concussion, and that becomes part of our education as well, and helping them have an understanding that of thinking just beyond today and the present and the circumstances that they're in, and thinking long term as well, thinking beyond the next game, and thinking beyond their career as an athlete in college, thinking lifetime beyond that, and we make those applications. Whether it's an anterior cruciate ligament injury in a knee or a concussion, certainly there has been a focus on those long-term decision-making processes with concussion, with the focus on CTE that's out there. But at least certainly from our standpoint, and I think in athletic medicine in general, there's been a greater education, appreciation on all of those risks, consequences, lifetime as well.
Last one I got for you. Can you just talk about what you perhaps see as the future of concussion protocol, and if you see the game of football being tweaked even more down the line?
Oh, everything does change, absolutely. So there'll continue to be changes to the game of football and the way that it's played. Hopefully, with some of the research and the data that we're participating in and that others are doing, that sooner rather than later we can make some changes that are going to make it safer for the athletes, that can educate them in a better way. I don't have necessarily a great strong sense on what all those changes are going to be, but again, everything changes. Football changes, so it's just it's typically all change for the good as well. Does that answer the question?
Yeah, of course it is.